Tonight I want to talk to you about breast cancer and breast cancer prevention. Breast cancer is a disease in which the tissues of the breast grow out of control. Breast cancer is the most common cancer in women in the United States. According to the Center for Disease Control and Prevention, approximately 220,000 women and 4,000 men each year are diagnosed with breast cancer. Out of those, 40,000 women and 400 men die yearly. There are things women can do that can help prevent breast cancer. Know the symptoms. Am I at risk? Know your family history. And one of the most important factors is breast cancer screening. Breast cancer screening, including self-breast exams and mammograms, may not stop breast cancer, but they can lead to early detection, which helps to fight cancer when it's easier to treat. Tonight we'll discuss different types of prevention, including diet, lifestyle, and breast cancer screening. Now that we have some of the facts about breast cancer, let's begin by discussing the importance of prevention. Breast cancer prevention is essential. Knowing the symptoms of breast cancer and the risk factors is important. Some women exhibit no symptoms at all. The most common symptoms of breast cancer include a lump in the breast or armpit, thickening or swelling of the breast, enlarged lymph nodes, pain in the nipple or any other area of the breast, dimpling or puckering of the nipple, discharge, and or any change in the size or shape of the breast. Any of these symptoms should be reported to your physician for further evaluation. Risk factors are divided in two categories. Non-modifiable risk factors are these that we cannot change, such as gender. All women are at risk for breast cancer. Age. All women over the age of 45. Race. Breast cancer is prevalent in white women, African women, and Asian women. Early menarche or late menopause is also a risk factor for breast cancer. Modifiable risk factors we can change, such as diet. Studies show that people who don't get breast cancer eat more vegetables and fruits than people that do. Vegetables and fruits are both good sources of polyphenols, which act as anti-cancer agents. The more fruits and vegetables, the better, says Peter A. Greenwald, MD. Laura Flynn McCarthy notes that we should replace 1 can of soda or cup of coffee with green tea. Compounds in green tea can help combat breast cancer. This is based on lab research at Boston University School of Medicine. Exercise. Any type of activity for 30 minutes per day. You'll significantly reduce your risk if you're within 20% of your ideal weight. The Nurses' Health Study, according to the Harvard Women's Health Watch, found that taking birth control pills slightly raises a woman's risk for cancer. Avoid smoking and alcohol, and breastfeed your babies when possible. Know your family's medical history. This is important because it might change your schedule for needing screenings, and possible treatments that can help prevent breast cancer. Breast self-awareness. Now that we know what to look for and what our risk factors are, we can move on to screenings. Breast self-awareness is familiarizing yourself with the look and feel of your breast. This way you can notice the small changes in your breast that can help lead to early detection. Self-breast exams should be done monthly, 3 to 4 days following your period. You don't want to do them while you're on your period because your breast could be tender and sore. And that would make you believe that you got swollen breasts when you really don't. Any changes that you note during your self-exams should be reported to the physician. A mammogram is an X-ray picture of the breast used to look for early signs of breast cancer. Benefits of mammograms is finding the cancer early when it's easier to treat. Risks include false positives, pain, and overtreatment. You should always talk to your doctor because he'll be able to help you to make an informed decision on whether it's the right time for you to start doing mammograms. As individuals, we can help to decrease we can help lower the death rate of this terrible disease. We can do this by maintaining a healthy lifestyle, a proper diet and exercise to maintain a healthy weight. Avoid alcohol and tobacco. Avoid smoked red meats, per Shape magazine. Women in good health should start their yearly mammograms at the age of 50 and follow up every 2 years. If you're a woman with a high risk factor, you should talk to your doctor about screening because you may need to start doing mammograms earlier. It makes sense to take a preventive stand against breast cancer because all women are at risk. Don't do it just to lower statistics. Do it for your health and for the people that you love. Prevention could help save money, sickness, and heartache. In conclusion, we have talked about risk factors and symptoms. We have discussed the risks and the benefits of mammograms. Self-breast exams alert you to potential problems and possibly the need for testing. Tonight, I am urging women to do their monthly self-breast exams and comply with their scheduled mammograms. These tests may not prevent cancer, but early detection could be the key to saving your life. Thank you.